In this section, I just wanted to give you some insight into the ICU, the intensive care unit. Understand that this is a completely different world. This is where the sickest of sick go. Most likely anybody who's had open heart surgery, aortic surgery, valve replacement are going to spend a period of time in the ICU, whether this is a few hours or most often over the course of a day or a night. The photo there at the right is me after surgery. You can see the number of IVs hanging. The white bottle is a deep sedation medication. You can see the mess of wires laying to the right or the left of my head, which included EEG monitoring for brain activity, central lines, and the blue and white tubing obviously goes to the ventilator and helps me breathe. So there are different rules and protocols to the ICU, and I'm not bringing this up to intimidate you or scare you or anything in terms of my knowledge as a physician, but just to let you know that it is a completely different environment, packed full of sensitive equipment, monitors and alarms, and you shouldn't be afraid of this. Just understand that it is going to be different and confusing and potentially noisy. So life in the ICU is fairly straightforward. Just ask the nurse or the ward clerk if you have any questions or you're not clear about something. Oftentimes there's a brochure that just gives you some simple rules and guidelines, but the overall driving factor here is that common sense really prevails. It's important to wash your hands or use hand sanitizer, before you go into a room and when you leave. Nobody wants germs spread and nobody wants an infection for their loved one. If you're sick, if you have a runny, snotty nose, if you're coughing, if you're hacking, if you're feverish, if you have flu-like symptoms, stay away. Do not bring that sickness into the ICU. Anybody with open heart surgery, their immune system's compromised, they're stressed already, and getting a cold or the flu on top of that can be quite devastating. It's important not to linger in the halls. I mean, everybody wants their privacy. Think about your loved one, how you'd feel if there was a group of people outside talking and laughing while you were inside visiting a sick loved one. If the door or curtain is closed, then ask if it's okay to enter. There might be a procedure going on, bed change, dressing change, central line change. There might be a variety of things going on that the patient wouldn't want you to see and you probably wouldn't want to see yourself. As I alluded to in a previous module, sleep is critical. It's essential. It's disrupted. It's important for patients to get sleep. And if they're sleeping, don't wake them up. Don't stimulate them. You can certainly visit quietly or just be present and share your concern in that regard, but let sleeping patients sleep. Remember to put your cell phone on silent. Nobody likes extra bells and whistles. There's a variety of sounds, extraneous noises in the ICU already, and having a cell phone or crazy music playing because your phone's ringing is really disruptive to the patient, other patients, and staff. And avoid loud voices. Nobody likes loud laughing, loud voices out in the hallway, and it's important to keep somewhat of a calm environment to help your loved one recover. In terms of children visiting the ICU, this is not prohibited in any means. Obviously, kids need to see their parents and their loved ones, and there are rules and there are expectations of children. They need to be monitored. Nobody wants a ventilator setting adjusted or an IV disconnected or any other device tampered or hampered with. The other point is to maintain a healthy self-routine. Not only is this stressful for the patient, but also for any loved one, family member, or friend who is part of the healing process. And keeping a regimen of self-care is critical. Eat, exercise, sleep when needed, and partake in whatever mechanism of de-stress you need, whether that's exercise, prayer, meditation, sitting quietly, reading, taking a walk, whatever it is. Keep yourself healthy. If you're sick, it doesn't do the surgical patient, your loved one, any good at all. Last, I want to bring up the point about valuables. Unfortunately, there's a variety of people coming and going, staff coming and going, ancillary staff coming and going. Unfortunately, visitors sometimes walk into the wrong room. And just leaving valuables at home or in the hotel room is a great idea. Don't leave valuables unattended in the ICU or any hospital room in general. The key point is not to fear the ICU. Just understand that it's different, that it has different rules, and you'll be fine.